Hello and welcome. This is the Baker Senior Show. We are here live on YouTube and Facebook, and then we're on all your podcast apps, your favorite ones, of course. And we're here every single week. Every Tuesday at 8 o'clock Central, you could come in and hang out with us live, or you can catch the replays. What we're doing on the Baker Senior Show is helping you live a healthier life and be protected. I know that Steve is so happy to be able to help you understand all about Medicare. And today we're going to be talking about Medicare Part D. So first of all, he's going to explain that there's A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P's.
It's not quite that bad.
Oh, okay. All right, good. So hello, Steve. How you
Good
doing?
morning. I'm doing great.
Good.
Yeah.
So let's get right to it. What is Medicare and what is Medicare Part D?
Well, of course, in previous shows, I've gone down to the A, the B, the C, and the D, and those are the main parts of Medicare. And Part D is really an important and integral part of the whole picture. Part D is a little bit different from A, B, and C in that it's all run by private companies. The government itself doesn't enter into it, other than they regulate it, do regulate Part D and make sure that it's in line with Medicare standards. But Medicare.
Okay, all right. So Medicare Part D is not run by the government; it's overseen by the government.
Exactly.
Okay, and do you get a special card for that, or is it included in the card that you have, or separate?
You generally get a special card, and you can participate in Part D in a couple of ways. One is if you go into Part C. Part C is the Advantage program for Medicare. It's one of the two major branches of Medicare. Most, if not all, of the companies that participate in Part C go ahead and embed their prescription program embedded inside of their program. So there's no need to go outside and get a separate Part D program. So on a Medicare Advantage plan, you've got A, B, C, and D all in one card.
Oh, okay.
So you actually don't even use your Medicare card at all. You have that one card, and then it's all inclusive. Otherwise, if you're outside and you do a traditional Medicare with a supplement, then you do need to go and get Part D and sign up for it, and you can choose the company that you want.
Steve, I have a question about that.
Okay.
So let's say you go with Medicare with a supplement.
Mm-hmm.
Is that typically what people choose? And the Advantage plan is just for special people? Is it balanced? Is it 50-50? How many people take advantage of the Advantage plan?
It's actually nowadays it's more 60-40. Yeah, 60% are the Advantage plans, and about 40% are the traditional. And the ones that for the most part that have the Medicare and a supplement, traditional Medicare with a supplement, are the ones that retire with a little more resources. Not all together, but generally speaking, people have a little more resources to go ahead and purchase a supplement plan. That's what I have, and that's what my wife has, and it works very, very well for us because we can go to any doctor or hospital in the United States at any time for any reason. So it works very well. We can, I don't like this doctor, so I'm just going to go through the phone book and get another one. and in that you have that freedom. But in the Advantage plan, it's not so easy. But it can be, it can be done. But there's certain periods of time in the year when you can do things, in certain periods when you're not allowed to do other things in the Advantage plan, and that's not altogether bad. But it does hold down the cost. One of the increments of it is that the Part D plan is embedded in the plan, so you don't actually have to go out and purchase another program or a Part D plan separate. So that saves money there. So it's kind of all inclusive. But the Part D plan runs throughout the Medicare system, and the pharmacists are all tied into it, and the doctor's offices, of course, have to order the drugs, and the pharmacist, for the most part, needs to follow the doctor's program that he writes down and they take to the counter at the pharmacy. There are a few cases where I've heard of it. I don't have any actual firsthand knowledge, but there are a few cases that a physician will order, maybe it's a mistake in their office or something. They'll order an inordinate amount or a much higher dosage than the pharmacist would say, "Whoa, do you really mean that?" So the pharmacist will check back with the doctor and make sure that that's what he or she really intended to do. So there's kind of a check there, but generally speaking, the pharmacists follow the dictates of whatever the doctor orders, for their prescription. So
that's interesting that they would. I guess there's a lot of different people making money and making decisions for us when it comes to our health care. And so that's probably why there's so much confusion, and there's people, calling us and emailing us and showing up at our door to try to get us to sign up. I always show my card that I got when I was 62. Okay.
There you go.
They wanted my phone number. They wanted my information. They have my name. They know how old I am. It's crazy. Right? How many people are involved in the Medicare industry?
Mm-hmm.
It's just supposed to be a government, thing that we're supposed to be able to get when we turn 65.
Mm-hmm.
And it's turned into all these different confusing things. And that's why they need you, because you understand it. You've been doing it a long time. You're on Medicare yourself. You've experienced healthcare issues and using your Medicare card, which I think is so awesome that you have the stories to tell, because that's how people really learn.
Exactly.
You can give me facts all day long, but if you can tell me a story about how you used your Medicare and how it worked or didn't work, that helps me.
Mm-hmm. Right. I think a couple of episodes ago, I had an experience myself to use my card and even ride in an ambulance. And someone asked me, "Well, what about ambulances?" And so far, it was academic. I had an academic answer to that, and I would say it looks like ambulance is covered. But in my instance, I actually used an ambulance, not with a sirens on or anything, but they took me to the hospital because I had a cut across my head, and I'll say, okay, now I'm going to find out.
Yes, you found out, didn't you?
It's been a month, maybe 2 months now, and I've never received a bill. And so now, when I'm talking to potential clients, they'll say, "What about an ambulance?" Well, I'll tell them my story, and I've never gotten a bill, so it's included, right? I didn't have to, which means I didn't have to pay anything. So
that's good to know. As we get older, we have less choices. When we're young and we're working and we have money flowing in and we can choose which jobs we want, it's different. We have choices, but as we get older, our choices are taken away from us. And I don't mean to sound like a Debbie Downer today, But I do want people to understand that there's a lot of things that can come up, questions that you might have, either for yourself, a neighbor, your parents, somebody you're caring for that has
Yes.
Medicare problems, or they have questions about, what's going to be covered. That way you can call Steve, and Steve is going to go over that information with you, and he'll steer you in the right direction if by chance he can't help you, which is very unlikely. I mean, what are the chances you couldn't help somebody, Steve, and you'd have to steer them somewhere else?
Right.
Not very often.
Right. Well, getting back to the Part D program, Part D, the government has designed it, and I'll say it's government designed, but they don't actually participate in the execution of the Part D. That's all done by private, as I told you, by private companies.
Right.
And Medicare oversees it. So they wanted to make sure that no one was actually left out of their drugs. So if you need a certain prescription or a certain drug, they made sure that you're not left out just because you don't have any money. And it's a very important part of Part D and even Medicare. There's something that's called LIS. We call it LIS, or Limited Income Subsidy. Mostly if someone doesn't have a lot of money, they're more than likely going to be put into a Advantage plan. And even beyond that, they can apply for LIS to pay for basically pretty much, I'd say 100% of their prescriptions. So they don't want people just out there wherever they live, or and we know there's different levels of income and different levels of society and so forth, but no one should or will be left out of their prescription program because they can't pay for their drugs. So the LIS program is out there, and there's some guidelines on who can take advantage of it and so forth. But if someone is watching the show and they know of someone who just simply cannot afford their prescriptions, then the LIS program is available to them. And a lot of people
Who is it
don't know that.
available to?
Well, it's available to mostly people of limited income.
Like any age, or just
Yeah. Medicare age, pretty much.
Oh, okay.
Medicare
So 65
age.
and older.
Yeah, 65 and older.
LIS, what does that stand for? Do you know?
Limited Income Subsidy.
Oh, okay. And is that run by the government?
The program was designed by the government, but it's run through companies.
Okay.
Yeah.
Okay, that makes a lot of sense. So somebody's getting paid by the government to handle this program called LIS. And it is important. If you're a diabetic and all of a sudden, you have no money, how are you going to get your medication?
Exactly.
So they can apply for LIS. Okay, well that's good to know.
And most of those people are what we call duals. By duals we mean they have Medicare, and mostly they qualify for Medicaid.
Ah, okay.
So that is not age 65 restrictive. So if someone gets on Medicaid and they're privileged to get in underage Medicare, they can do that. And then in addition, they could possibly sign up or be appointed with LIS. That's a possibility. So there are all kinds of programs that are out there for people of low income means. But moving up the strata, there are other things that are really good. Of course, if someone is making a nice income and they're working and they've got a family and so forth, LIS, of course, is not in the picture at all. But there are all different plans for various people. Mostly people 65 and older.
Steve, I have a question about the ABCs that they assign. So is there a reason for it, or they just pick the next letter in the alphabet to go with a program for Medicare?
Well, going back, I do a seminar that where I bring up the whole history of Medicare. But going back to the original Medicare, and a lot of people don't know this, but the listening audience is getting ready to learn who received the very first Medicare card, and that just happened to be former President Harry Truman back in 1965. And the story is that right after World War II, when Franklin Roosevelt died in 1945, Harry Truman was the vice president. So he inherited the seat of Franklin Roosevelt. So he became president, and he served 2 terms. He served that term, and then he was elected to 1 term in 1948. But he really, really, really did want government health care. England had it, and Canada had it, so he thought we should have it. But even Harry Truman was never able to get it through Congress. So in 1964, right after President Kennedy was assassinated, Lyndon Johnson took over, and he came from Congress, and he was Senate Majority Leader for years and years. So he knew how to buttonhole people, and he knew where all the skeletons were buried. So so that's government talk. So he knew where all the skeletons were buried. So he said, "Look, you're voting for this, right? Look at me in the eye. You are voting for this. Is that correct?" Yes, yes. So he was able to sign up, and Harry Truman was the first. Bess Truman was the second. Lyndon Johnson flew to Independence, Missouri, and Harry Truman was long passed out of the presidency, and he was retired and so forth. But he did sign him up as the number 1 and number 2. So it was there. It was just hospital insurance in those days. That was it. Just pays for the hospital. And people, tried to work out arrangements with their doctors, but it's like everything else. It goes through a process. It's evolved, and then next came the doctors, and then other add-ons to the to the Medicare, much like I'm talking about with the Part D and everything. So it's gotten more complicated. So whenever they brought in the doctors, they had to have some way to designate it. So some bright person said, "Okay, we'll call it A for the hospital, and we'll call it B for the doctors." So that's how that worked.
Yeah. There you go.
And then they came up with the Advantage plan at some point, and they said, "Okay, let's see, what can we do?" Somebody said in the room, I wasn't in the room, so I don't know, but someone said, "What about C? That follows A and B." "Oh yeah, okay, terrific. We'll do
call
that."
it C.
Yeah. And later on in 2006 was when the prescription program came in. And I guess it's those same people sitting in the same room saying, "What can we name it?" "I know. Guess what? It's C."
A,
A,
B,
B.
C, D. Yeah. How far does it go? Like all the way to K?
I don't know. There's other aspects of that. It's inside of the supplements. They do have K's, and but that's a different world, a different story. Doesn't have anything to do with Medicare itself. But anyway, that's today in the year 2020. We are living with A, B, C, and D. That's it.
Okay.
And then there are offshoots of all of those and so forth. But it's created a kind of a conundrum, so to speak. It's so you have to sit somebody down and explain it so that they can begin to understand, which I've done pretty much hundreds of times with people.
So I have a question on traveling. People are at home now because of this virus that's going on, and people are staying home. But when they start traveling again, does the Part D cover you when you're in a different state or a different city or a different country?
Yes. Yes, but remember there are two kinds of Part D. Just to complicate it a little more, Part D inside of C, and it's embedded inside. So if you're on a Advantage plan, then you have the one card that I talked to you about earlier. You have the one card, and inside that is a D plan. Those people who are on an Advantage plan do not have the privilege of just going anywhere and staying and letting their Advantage plan work for them. They are zip code specific and county specific. And then that takes it to states. Various states have certain programs, and various counties have other programs, and so forth. So it's a little bit complicated. And I would advise anybody who's considering an Advantage plan to, once they do that, they need to consider just to stay put. That's in loose terms what I'm saying, but they're
I'm so glad that you're explaining all of this, Steve, because I think as we get older and we retire from our jobs, we start thinking about traveling, and no one tells us this. No one educates us on the problems with our health care, especially the Medicare program, right? No one explains that. We retire from our corporate jobs, and we get on Medicare, we buy a motorhome, we start traveling around, and no one told us, gee whiz, you're not going to be, this is the United States of America, it's a Medicare card. You would think everybody would just take care of you. And it doesn't work like that. And so I'm so glad that I have been closer to you so that I've heard this now, because that's part of my thing. I want to get a camper van and I want to travel around the country. Do you think I'm going to take an Advantage plan? Heck no.
Right.
I want to be covered like you are. I want my ambulance covered. So here's my thought about that. I need to make sure I have enough income to get a supplement. That's what I'm hearing you say. If you go with traditional Medicare, you need a supplement to cover other things.
Right.
And that way you can go anywhere in the United States and be covered.
Medicare itself in that arena will pay 80%, and the supplement will pay the remaining 20%. Save a small deductible depending on your income and so forth, but there is a small deductible that you pay at the first of the year. But otherwise, you pretty much have 100% coverage.
And I've heard you say many times that we use 80% of our health care cost and money at the end, the 20% of our.
Yes, pretty much. If you use 80% of your health care coverage in your life, in the last 20%.
There you go. Life. I knew it was something like that. And I do think about that. I've heard you say that several times, and I think about that. I've been very lucky. I've had a hospital stay when I had my baby, and I had a hospital stay when I broke my arm. But other than that, I've been really healthy. I just go to the doctor once a year or twice a year for blood work and checkups, and that's it. So as I get older and my body starts, getting older, I can see that is something I need to think about. But you don't think about it when you're young.
Right. It's true.
Young and healthy, and nothing can go wrong, right?
That's true. Yeah. You think nothing can go wrong.
Right. You're hoping nothing goes wrong.
Underage, what we call underage is another story altogether.
Yes.
But
well, what about what else do you need us to know about Medicare Part D?
I think that's pretty much it. I think I've pretty well covered that. And of course, the closer you get to age 65, the more you're going to want to learn about it. And if you're sitting here watching this at age 40, well, you're going to say, well, okay, I'll just check into that much later. But it's important. Like your age, would you say 62?
I'm 62, yes.
Yeah, when you're 62. So those 3 years between 62 and 65 are the years where you really need to get educated about it. And I've said many times that it sounds like a whole lot, but it is. There's no question about it. But because of the baby boomer situation, and after World War II, so many people were brought into this world. It's just kind of an explosion. It's a bubble that's kind of like a bubble going through a water hose. It's just kind of going through our society. And when all of those people were entering school, they had to hurry up really fast and build a whole bunch of different schools in order to keep the kids. So that's just going all the way through up until there's time for them to retire and go on Medicare. So about between 10 and 11,000 people in the United States are turning 65 every day.
That's amazing.
Every day. Not every month, not every week, but every day.
That's amazing, truly.
Yeah, yeah. So
we just need them to call you, and they can get a hold of you, and you can talk to them about anything Medicare related at 832-754-3292.
Correct.
Steve is very friendly and very helpful, and I know everybody's situation is just a little different, and you might have heard something today on the show that has you thinking, gee, I wonder if I should take the Advantage plan, or if I should get on the traditional and how much is, if I get a supplement, how much is that? And how much is the deductible? I mean, there's all kinds of questions that could come up as you're thinking about either yourself, your neighbor, your parents, somebody you're caring for. And those people, including yourself, you might have some questions, and Steve can help you. Sure. If he can't help you directly, he knows the phone numbers of the people that can.
Yes.
Now, Steve, I want to go over this one more time. I think this is so important. I get this in the mail.
Mm-hmm.
It says Medicare recipient, new extended benefits available.
Mm-hmm.
And do you see here where it says phone number is required?
Right.
If I didn't know Steve Baker, I would have put my phone number in here and sent it back, because I need to know, well, what are the new extended benefits that are available to me?
Uh-huh.
This is a ploy, people. This is a ploy. This is not something you need to do. It is not required for you to put your phone number in. You can call Steve instead.
Right. Well, for years, what I've done is I've gone into homes, and they've got on the dining room table, they've got a stack like this of mail that they've gotten, because as you get closer to age 65, you get more and more. The postman really does begin to like you, because he brings a lot of mail to your house, and it's that stuff just starts to come in, and the phone starts ringing and so forth, and so I point to the stack on the dining room table, and I'll say, you know what that is? And they'll say, what? I said, that's piles of confusion is what that is. So I'm able to go through it and sift through it and show them, what they need to pay attention to and what they don't need to pay attention to, and ask them questions, kind of diagnose the situation and kind of see where they are and make some recommendations. Nowadays, I do that online. We have the technical capability, like you and I right now are in 2 different locations. So we're able to do that. And now I'm able to converse with people online and do what we call the TV, or there's different programs that you can do a situation like this. And
Yep.
it works just as easily.
It works fantastic.
I
modern technology at its best.
Believe it or not, I can get someone's signature over the internet.
I know, crazy, isn't it?
So it's like,
look in my eye. Yes, I say yes. Oh, that's funny.
So it's crazy.
It is. Well, Thank you for being here with us today. Thank you, Steve, for enlightening us on Medicare Part D. Every single week, we're here to help you understand more about Medicare and how it can help you, and all the different ins and outs of the A's and the B's and the C's and the D's and everything after that. So don't you worry about a thing. If you have any questions, please let us know. We'd be happy to have you on the show with us if you'd like, and we'd be happy to answer any questions. Don't forget to call Steve at 832-754-3292, and we'll see you again next week. Bye for now.
Bye.